Hello, my name is Andrew from Active Physiotherapy, and I've done a video of exercises for people who are either suffering from back pain or would like some help to keep their back mobile and improve the strength of their back. I've kept things nice and simple. There's only 3 exercises to do: the hip twist, the pelvic tilt, and the prone extension. For each one of these 3, I have done a variation for flexibility and strength. These can easily be done in the house, in the garden, or in the gym. If you have any problems or you want to ask more questions, just give us a call or you can email the clinic. I hope you enjoy. Thank you. The first exercise is the hip twist. Lie on your back, knees bent, feet flat on the floor. Roll your knees from one side to the other, keeping your shoulders on the floor. Try and avoid pushing into any pain, and try and keep the movement nice and controlled. Repeat 10 times each way. A progression from the hip twist to add a strength element is to have your feet off the ground, hips and knees bent to around 90 degrees. Slowly roll your knees from side to side, trying to keep your shoulders down and keep the movement controlled. You can help by tensing your core muscles by gently pulling your belly button down towards the floor as you roll your legs side to side. This is not a very good exercise for anybody that's currently suffering from significant back pain, as it can sometimes flare up your symptoms. Repeat from left to right between 5 and 10 times. A useful stretch using the hip twist is to have your knee bent and foot placed on the outside of your opposite leg. Gently pull your knee towards the floor with your hand and keep your opposite shoulder on the floor. Feel the stretch in your lower back or into your buttock muscle, and hold this position for between 10 and 15 seconds. Repeat on the other side. A second exercise that can be progressed is the pelvic tilt. Here you start with your knees bent, feet on the floor and feet hip distance apart. You roll your pelvis backwards and feel a gentle stretch in your lower back. It can be useful to have your hands on your pelvis and feel the top bone moving upwards towards your head. Repeat 10 to 15 times. The pelvic tilt can be turned into a strengthening exercise using the pelvic bridge. Here you start in the same position with your knees bent, feet flat on the floor and hip distance apart. You roll your pelvis backwards and then lift your bottom and then your lower back off the floor and hold this position for up to 5 seconds. You repeat the movement between 5 and 10 times depending on how much effort it is for you. You can even try and hold the position at the top for long periods to try and build up stamina of up to 30 seconds. A further progression is to get into the pelvic bridge position and then extend one of your legs and hold this position for between 10 and 20 seconds. Repeat on both sides, but recycle the movement before you repeat. This exercise can also be made even more difficult by lifting both arms and pointing them towards the ceiling whilst in this position. My final exercise is prone extension. Here you start laying on your front in a nice relaxed position, arms out to the sides lightly. You lift your chest off the floor, and as you get to the top of the movement, you take a little sigh and relax. Repeat for 10 times. It is important with this exercise not to push into any sensation of pain in your lower back. So only go as far as the pain will allow you. The progression is to push further into extension. Here you place your hands flat on the floor and lift your chest backwards by straightening your elbows without your hips coming off the floor. This is a really good exercise for upper back and lower back, but care needs to be taken not to push into pain or irritate your symptoms. Repeat nice and slowly and relaxed 10 times. Our final exercise progression is the prone bridge. This is a strengthening exercise most commonly known as the plank. Here you rest on your elbows and your toes, and you lift your hips and your knees off the floor to make a straight line without extending your neck. You hold this position for 30 seconds to a minute.